Bringing a fresh new perspective on the challenges and issues that face our criminal justice system and their impact on all New Yorkers. This is Justice Matters with your host, President of the New York State Supreme Court Officers Association, Patrick Cullen.
Good afternoon to all our listeners here on AM 970, The Answer. My name is Patrick Cullen, and I am the president of the New York State Supreme Court Officers Association, representing the very best officers in the nation. As always, it's a pleasure to welcome you back to Justice Matters, a show that highlights the very important role our court officers play in maintaining safety and security in our Supreme Courts throughout New York City and the 9th Judicial District. As I do every week, I want to touch on a few issues and developments since our last episode. But this week, we're not going to be facing issues or talking about things that have happened in the court system, criminal justice, policing. I want to talk about healthcare, and our entire episode today is educational discussion about the state of healthcare, where we've been, where we are, where we're going. I think as a society, we are constantly inundated with information, both good and bad, about healthcare. Its current state, reforming and changing it, issues with maybe pharmaceutical companies and prices. As unionized public employees, we're constantly made aware of our coverage and the price of health care. And many times, we're comparing notes with our brothers and sisters who work in public employment. Other agencies and other municipalities have health care plans separate from ours, different from ours. And when you compare notes, so much of this information seems to become erroneous. Oftentimes, it's skewed to create a giant misunderstanding about the state of healthcare in general. And make no mistake, this is a monumental issue we all face these days, and perhaps the most important part in time in many ways. The past, the present, the future of healthcare are critically important to us all, and it's my intent with this episode to get a little deeper into some of the issues we face, educate our listeners, most especially SCOA's membership, and to help us understand more about this very complex topic are today's guests, President and CEO of Empire Blue Cross Blue Shield, Mr. Alan Murray, and Vice President and General Manager of New York Labor Government Accounts for Empire Blue Cross Blue Shield, Mr. Tom Canty. Gentlemen, welcome to Justice Matters.
Thank you for having us.
Yeah, thank you very much for having us.
Appreciate it. And this has been something that has been on my radar as having a discussion about this. We want to dedicate the entire episode to this because it is so vitally important to not just our membership and public employees in general, but everybody, right? I mean, our parents are getting older, and our children and facing a lot of health issues, and we want to kind of see where we're at and where we're going. And I know there's a lot of debate about it, especially in the upcoming election. It's become a big topic of conversation next year for presidential platforms. And so let's get into a little discussion. But before we do, just introduce yourself, how you got involved in the health insurance field and Empire Blue Cross Blue Shield and the industry in general. Alan?
All right. Well, as I'm sure you and all your listeners will hear pretty quickly, I have a very strange Brooklyn accent. So I was actually born in Scotland. I grew up in London, and I was an officer in the British Merchant Marines for 6 years. Happened to meet a wonderful New Yorker, and I became her souvenir. So I also think I'm the only person probably who can say their mother-in-law's cousin's best friend started them off in healthcare. And that actually happened. So I started Empire Blue Cross Blue Shield 2002. I did a stint at United Healthcare. I actually created my own health insurance company called Care Connect out in the island with Michael Dowling and Northwell Health.
Okay.
And 14 months ago, I was given the honor to come back home to Empire Blue Cross Blue Shield, where it started for me in this country as the president and CEO.
Well, that's a great story, and welcome as I think our first international guest here on Justice Matters.
Thank you.
Tom, how about yourself?
Yeah, well, again, thanks for having us. We appreciate the opportunity, and I've been doing this for the last 25 years. Prior to that, I worked in government. I'm an attorney by background, and I worked when I was in government with the unions in the last Cuomo administration for Mario Cuomo, and we take the healthcare of the union membership very seriously, and we try to work with them to give them as many benefits as they can for the best bang for their buck. So we try to work with all the union leadership, and we're very lucky to have the partnerships that we have with you guys.
Yeah, that's terrific. I mean, it is a tough. It's a tough topic, and it's something that is hard to explain to people who kind of don't know. Some funds are deducted from their paycheck every 2 weeks. They go to a doctor, and things are taken care of pretty well, very well, as a matter of fact. But Tom, I've heard you speak at a number of meetings and conferences, and your expertise here is second to none. So I'm really glad you joined us, both of you guys. What's the top priority for Empire Blue Cross Blue Shield, and why?
Yeah, and that's I think at least for our organization, that is without a doubt the most important question we'll talk about today.
Mm-hmm.
So the top priority right now comes a little bit from my belief, right? So healthcare is complicated, right? No matter what benefits you have, when you think about your copays, your deductibles, the different ways you interact, which providers you go to, is it in-network, is it out-of-network, it's a pretty complicated industry, right? And probably the most concerning part of it is you have to navigate it when you're sick, right? So you're generally not at your best consuming information and trying to learn when, you've got 104 or you broke your leg or you have some other illness.
Right.
So the number one priority for Empire Blue Cross Blue Shield is by 2025, we will make all New Yorkers healthier, right? So that's it. Everything we do from this point on is about that mission. There's a lot of statistics out there that measure the population of New York compared to other states and county by county, and I firmly believe it is our job to make it healthier, right? To make the state healthier and the people in it. So that's it. I mean, it sounds simple, but
Yeah.
it's
It sounds simple, but how do you get there then? Maybe we're going to get into
Yeah.
some of that. And that's obviously that's a tremendous goal to have. And how we get there is the question. How, in maybe some roadblocks and obstacles that are coming our way, how do we get there? But what are some of the top health conditions that we need to address now and in the future?
Yeah, so, I think if we look at the entire population, right, we're living a lot longer. And so you're starting to see a lot more comorbid, multiple conditions at the end of life or even before the end of life. So, COPD, pulmonary issues, cardiac issues, obviously cancer. And not just that, cancer combined with a number of other issues at the same time.
Right.
But also I think some of the more social problems we're starting to deal with, obesity, right, diabetes, the way people go about living their lives.
Yeah.
And it's interesting because from my perspective, if you trace back those issues, it's really about education, social determinants, where you live. That has a huge impact on it too. So those are the things that really stand out that we're trying to tackle.
Right. And so what's the way? What's the approach to attack maybe new issues that people are facing in their everyday lives? You mentioned weight, obesity, and diabetes as a result. I think of stress, especially with our members. Stress-related illness. Yeah. How are we approaching trying to make those people healthier with these newer kind of things that are not the traditional, heart disease, that type of thing?
Yeah. Well, obviously, let's face it, it's not a complicated issue. It's a very complex issue, right? Especially when we think about we're looking at the entire population. So some of it's traditional, right? So I was at Northwell yesterday with Michael Dowling, and we had a really great session talking about how what they're doing matches what we're doing and how we are completely, interdependent. So some of it's traditional. How do we get data to your physician? How do we coordinate your care? How do we make sure you're on the right medications? You're not getting opioids from your dentist, opioids from the ER, and all of a sudden, you join the opioid crisis.
Yes.
A lot of it, though, is starting to move into technology, right? So if you think about stress and the behavioral side of that, the mental health that goes with that.
Right.
We're now launching online live health online programs where you can make an appointment with the same psychiatrist, the same person each time, no matter where you are, any time of day. And you can start taking away some of that stigma, right? So you can start treating people's health and stress. And really, it's about access and coordinating the data on the back end.
Yeah. Do you think that the way that we are functioning as a society, with advances in technology that are beyond our belief when just a decade ago, how are we approaching that from the healthcare perspective and then from the insurance perspective with things like possibly robotic technologies and things like that?
Well, I would look at it from almost like a different perspective. I think what we do really well in this country is we treat people that have serious diseases very well, and we do it better than the rest of the world. But I think where we lack is primary care. And I think we've been involved as an organization in trying to bolster primary care, supporting organizations, especially in the minority communities, to give that population scholarships if they would commit to being primary care doctors. So I think that's a way really to go, because again, we do a very good job. If you're really sick in this country, it's the best place to be. But as far as primary care goes, we really lag behind the rest of the world. So I think that's someplace we really need to improve.
Yeah, it's very interesting you say that, and I applaud it, because you as a organization, and you guys are executives here at a massive conglomerate, basically, saying, hey, this is what we know we do well. This is where we know we could use some help, but let's incentivize people to try and fill that gap a little bit, and that's commendable to towards the goal that you were mentioning, Alan. How are we going to make this a full assault on trying to make all of New York healthier? Again, we're going to do the entire episode here with these gentlemen from Empire Blue Cross Blue Shield, and if you stick with us, we'll be right back with Justice Matters after this message.
We return now to Justice Matters with the president of the New York State Supreme Court Officers Association, Patrick Cullen.
Welcome back to Justice Matters. We're continuing our conversation with Alan Murray and Tom Canty from Empire Blue Cross Blue Shield. Obviously, a phrase that's mentioned a lot in a lot of circles, newspapers, television these days is, quote, Medicare for all. What is Medicare for all? And what's your take on it, Alan?
Yeah, I think that's the question everyone in the country's asking, right? What is Medicare for all? Or there's a bill right now in the New York legislature which is single payer.
Mm-hmm.
Right? That's kind of the other way to look at it. What is it? It's as I said, who knows? I mean, I think what we've seen over the last 10 months or so, and obviously the presidential elections and the debates that are going on there, is what I would call a Twitter. Right. It's great for a couple of hundred characters to say Medicare for all. Listen, you're not going to pay for anything. You're not going to pay for coverage. You're not going to pay for deductibles. You can go wherever you want, however you want, whenever you want. It's all free.
Right.
Listen, there's a big reality, right? We know that it's a multi-trillion-dollar industry, and so there is going to be impacts. Some of that information is beginning to come out, obviously, in terms of what's been released earlier. But I think a lot of us are asking the same question: what is it, and why do we need it?
Right. Especially here in New York, and as somebody who participates in the Empire Plan as a New York State employee, it's why do I want something different at this point? Yeah, I think I think you hit it on the head. It's a campaign slogan at this point, more so than a reality. And the bill that you reference is, I believe, been put up for debate and to be voted on 27 years in a row by Assemblyman Gottfried. The New York Health Act, I believe it's known as, and it's a state version of Medicare for all. So, what do you think? Empire / the insurance industry in general can do to change the landscape with the potential of Medicare for all?
Yeah, well, from my perspective, we have to ask two things, right? What is it we're trying to get here, right? One of them is universal coverage, right? So if we think about New York, only 5% of the population doesn't have coverage, right? And by the way, a lot of them qualify for coverage. So there are other reasons behind not having coverage.
Right.
And I think that's something we have to work with the governor's office, with the legislator, myself, and so forth. The other reason is cost, right? We know that we have great access, like Tom just said. When you're sick, this is the destination. I mean, I'll tell you in a minute when you ask the right question, Pat, about my experiences growing up in a unified national health service, right? So I've got some horror stories. So at the end of the day, it's expensive, and we have to pay for it. But it's an incredible system. And so I think what begins to change is how do we as an insurance company partner with providers? I mentioned earlier, I just left Northwell, where Mike O'Dowling and I have known each other for years. We literally launched a partnership. How are we going to work together? Even to the point where we want to work on legislative improvements. So we go together to the state and say, hey, here's what we think we should do. So I think that if there is anything that's coming out of the debates, I think it's a renewed focus on improving what we have, not ripping it apart.
Okay.
And I would just like to add on a couple of things to that. You know, just from, because I deal with a lot of union health funds, to both your points, there was an article this week in the New York Post that talked about how the single payer system was being, on the legislative agenda this year in New York. And a lot of the unions sort of took umbrage with it because, in effect, they'd be losing what they've negotiated for years. And so I think, and that's and also the building trades too have the same type of position across the country, that they look at it like, well, we have these good benefits that we negotiated, so why would we give them up? And the second thing, to your point, you said, what was it, 25 years ago this bill's been introduced? Well, probably 25 years ago there was a big need for it, but now under the leadership of the governor in New York, the coverage, like Alan said, we're down to 5%, and probably out of those 5% of people that don't have coverage, they're eligible for some program. They just probably don't know enough to apply for it.
Right.
So I mean that's a problem. I think we should help those 5% of the people. But if one of the goals is universal coverage, we're like almost there.
Yeah, right.
And we still have choice.
Right. So what's the use? So what's the use of continuing? Maybe there are other reasons for the bill to continue to be entered as for consideration. And I absolutely agree with your assessment, Tom. And I've been at some similar meetings where a lot of union representatives say, wait a second, we gave up a lot of financial compensation in order to get more affordable health care or a deal that allows us to pay X amount, or in some cases in New York City, zero.
Or a particular set of benefits you might have bargained for and given up salary to get those benefits.
Now, when are we going to ever see that back? Never is the answer. And the other issue is, if we were to move in that direction, the tax bill that comes back will be greater than what we're contributing to our health care now. So it's they cancel one another out. And so it might look pretty, but let's get into the trenches and see what happens. And ultimately, my wallet looks less full because of the new plan, the single payer / Medicare for all, whatever you might call it. I'm going to get hit. The regular guy, the middle class guy who is just putting in my service years, waiting to get to my pension age, is going to get hit now, 15, 20 years into my employment. It's going to be worse for me, but in tax.
And that's just talking about financial.
Right.
I mean, let's think about the reality of single payers, right?
Yep.
You can't.
Alan has some experience, personal experience.
Free is not free, right? I mean, nothing in this world is truly free, completely, access whatever you want whenever you want. There has to be controls. So one of those controls somehow is going to be rationing. So I'll give you an example. And I've never asked my father permission to say this, but I tell it to him all the time. So when I left home, my sister, who was much younger than me, also went to college. My dad was a cop. He was an officer in the Metropolitan Police in London. He was my hero. I mean, like anyone else's dad, right? They're a hero. And I get a call from my mom that he has an alcohol problem. So he's hit the bottle very hard. So I fly over, and I get there at 8:00 in the morning, and he's already finished a bottle of wine. So I call up the NHS, and I said, listen, my dad has an alcohol problem. I think I need to get him into a 28-day program. That's what I've heard. And they said, well, how long has he been sober?
Right.
I said, he's already drunk a bottle of wine.
Right.
They said, well, when he's sober 30 days, call us, because then we know he's serious.
Oh, wow. Wow. And this is as you referenced before, this is a firsthand story coming from socialized medicine, governmental medicine. So it's put on the individual to help themselves before they can seek further help.
Yeah. In this situation.
Wow, it's crazy. And there are many many stories about people waiting long periods of time, sometimes getting more ill while they wait, wait lists and death lists and likeliness, and there's it's sad because we are used to, I get sick, I go to the doctor / hospital, and it's it's triaged out. Obviously, here's what's wrong. Here's what we can do about it. And we've become used to that, and to change that is, I think, dangerous and somewhat irresponsible for not even maybe even for some of us, but for the future, for kids. They're not going to know the benefits of great healthcare that we've enjoyed for so long. Before our next break, what's the state of healthcare system in New York, Tom?
In New York, I'd say, we have very good healthcare in New York. We have a lot of choice. The market's provided various choices to both employers and to governmental entities throughout the state. And getting back to the area that I work in the union area, I could say that the unions in this state provide unbelievable healthcare to their members. And it's a variety. It's you have government plans like you have. The city has a great government plan, and also a lot of the Taft-Hartley funds have various plans based on the level of their contributions from their employers and how much money they produce in their salary. So I think in New York, that's a really good distinction for us in New York. And the other thing is, our hospitals here in New York are second to none. I mean, they are wonderful institutions, and they are at the cutting edge of technology, and they do a wonderful job as our partners working with them. And I think in general, the members of all these unions are very happy with the care that they get these great institutions.
Yeah, I agree. I think we have destination hospitals from around the world, and it's hard to argue with that. My concern is, what do those institutions become under different circumstances down the line? And we can get into that when we come back after this break.
Welcome back to Justice Matters with your host, Patrick Cullen, president of the New York State Supreme Court Officers Association.
We're back with Justice Matters. Joining me, Alan Murray, president and CEO of Empire Blue Cross Blue Shield, and Tom Canty, vice president and general manager, New York Labor Government Accounts, Empire Blue Cross Blue Shield. Thanks for hanging in there with me, guys. We know that the insurance industry is not always trusted. Explain what that means, and how you take it from your perspective, and how we can change that.
Yeah. I think a lot of this is, it's easy to make us the reason, right, for things not going well, right? It's easy to vilify us. The reality is, and we mentioned this earlier, healthcare is complicated, right? Very complicated. And whether it's in our system or another system, you still have to have eligibility, you still have to have AD cards, you still have to have member call centers, you still have to have all of the administration that goes behind it. And that's something we do with scale, right? The other thing which is really, I think, important for folk to understand is not all care is necessary. Right? And so there's a lot of procedures out there that may appear right at first pass. And listen, we trust our physicians. Right? I mean, listen, they're trained. There's still this. The physician is always right. Now, that's especially true where I grew up. And the reality is, when they call us and they say we want to do the following, we're really saying, well, is that what the patient needs? Right? So if they have lower back pain and they're jumping to surgery, they're saying, have they tried physical therapy?
Right.
Because, by the way, in the first couple of years, generally, physical therapy can be equally as impactful.
Right.
And so that's why I think we look like we're a barrier. We're skimming off the top. And the reality is, we're really there. Going back to our mission, right? That's who we are. We have done a really bad job of telling our story.
Right.
I mean,
it's and who is then left to tell the story? But obviously, people who've had different types of experiences. I deal with people on a one-on-one basis very often in leading the union, and for every time that you hear one story of, hey, my family member got sick, and ultimately, in order to get well, it really, it was taken care of. For a copay, my son had surgery. It was affordable. It was pretty turnkey. You'll hear two or three people who are dissatisfied, and so if you're allowing people the good message gets tamped down by the bad, and
the squeaky wheel.
Yeah,
right?
absolutely.
I mean, how many people are aware that last year We diagnosed over 30,000 people with diabetes because of the way we interact with vision providers and medical providers.
Right.
So just that little puff in the eye, because we have that data interaction, we diagnose them with diabetes.
Yeah.
I mean, diabetes going untreated is pretty severe.
Yeah.
Not a lot of people jumping up and saying thank you for saving us.
Yeah, and so I mean, then you're becoming like a leader in the industry in that way, and in trying to create new ways of the positive experience when using healthcare, right? What role? Actually, let me ask you a question. What is IDR?
IDR, simply independent dispute resolution.
Okay.
In the application right now, so let's take it through its full kind of journey. Back in, I think it was 2014, the state passed a law that said if you're in a surprise environment, so let's say you're in the ER and you show up to a PAR hospital, it's a PAR participating ER, and all of a sudden the person who treats you is non-PAR. Well, you didn't know that. You went in there hoping for the best. Or you scheduled surgery and the person assisting with the surgery is non-participating and you get a huge bill. The state says that can now go to an independent person that basically determines the appropriateness. Earlier this year, with the help of our friends in labor and unions and so forth, we managed to pass the first of its kind in the country, the application of that to hospitals when they go out of network. So here, one of our biggest issues as an insurance company was when we negotiated with hospitals, then they went out of network. They jacked the charges up, all the way up. You know, sometimes 3, 4, 5+%. And the reality is, under New York state law, we have to pay it.
Right.
Now the IDR, that bill says the maximum that we're liable for is only 25% of what the in-network rate is. And we can take that, as can the hospital, to a dispute resolution.
Oh, okay.
So basically, we've removed the ability of the hospitals to weaponize their charges,
Right.
which is what they were doing before.
Does that help you keep costs down ultimately?
That's exactly the purpose, right?
Yeah.
I mean, if we're going to improve the health of your members, health in New York, healthcare's got to be affordable, right?
Yep,
It's that
absolutely.
simple. If you can't afford healthcare, you can't fulfill our mission, and this is a huge part of it.
And from the New York perspective, Tom, what role is Empire taking in the future to assist New Yorkers in things like this, and maybe some other topics that maybe are newer types of ways of communicating with the people who use the plan and so on and so forth?
Yeah, well, specific to New York, what we've been trying to do is to design health plans around the needs of the different unions and the different funds. And with that in mind, we design different programs, whether it be diabetes, asthma programs, primary care programs, in order to meet the needs of that particular population. So if you have if you take the building trades, for example, we try to make sure that they have proper access to orthopedic care and like Alan said earlier, conservative orthopedic care, because they always have back problems, because
Right.
they're always lifting things.
Right.
So we try to design programs around their particular needs to meet their particular disease conditions that they have.
Right. It sounds to me like you guys really have taken a role at the forefront of shaping the future of the insurance industry, not just here but throughout the country. I mean, your backgrounds say as much. Give me one thing that you're looking at to kind of be again something maybe we're not thinking of, the forefront of the insurance industry in the country.
Yeah, so there's one thing, but it builds on a number of others, right? So I mentioned, our interaction with vision, right? We also interact with dentists the same way when we have that benefit, life, disability, accident, a whole host of other things. And what's really important about that is it all sits on one platform. And so we now have the ability to interact with different benefit types and really cover your whole health, right? So you as a person and interact with the physicians and understand what's going on. We're now introducing at the true forefront artificial intelligence. By the way, that's mixed with human intelligence. Just so you know. And in essence, the way we're interacting with our technology now is, for example, if you call us, you're actually speaking to a person and a computer. Now, you don't know the computer's listening,
Right.
but the computer's understanding what your past has been, your claims history, even if you use our apps, what you've been searching for. And as you're speaking, it's listening to your native language, and it's suggesting to the person on the phone all the things you're actually saying.
Wow.
And so if you say, listen, I really want to know what my benefit is for physical therapy, the computer has already listened, pulled it up, and pulled up all your claims so that that person on the phone can actually guide you through it. So really it's digital first technology, and it's a healthcare plan for one person. Yeah. Because that's the way that we're moving forward with that technology.
That's incredible. I don't know what to say to that other than I really can't wrap my head around it, but it's amazing. And you know, it's almost science fiction in a way,
That's
but come to
exactly what it
life.
sounds,
That's where
right?
we are. We're in we're going to 2020 here. This is not 1950 anymore. Right. What do you say to the people who say that the changing healthcare landscape, and however it may look, whether it be what we discussed earlier or, you know, the gig economy / technology, people won't want to become doctors anymore. What do you say to that?
You know, I think there's probably an element of truth to it, right? That being said, when all the doctors and physicians I've interacted with in my time, they became doctors because they want to make people healthy.
Yeah.
Right? They want to treat people. And I think that comes from the heart. That's deep down. And yeah, there's barriers to it to some extent. But, I mean, if we go to the medical schools, the people who are applying for these medical schools, they're bright. They come from all sorts of diverse backgrounds. And they believe in making people healthier and treating them.
Right.
So I don't know if there's as many barriers as people perceive.
Yeah.
I still think it's about that individual and what they want to do with their lives.
Okay, but in the same vein, what happens in a hypothetical future where insurance industry is changed in some way, shape, or form, as we've been discussing here? What happens to the individuals, the probably hundreds of thousands, if not million people who work in the insurance industry?
Yeah.
What happens there? Any insight? Or I mean, at this point, it's speculative, obviously, but you know, it's definitely a topic to be talked about.
I'll answer, I think, from a kind of broad perspective, and obviously Tom's worked inside the organization for a while and
Right.
has broad implications, not just for us, but I think, you know, for obviously your listeners as well.
Sure.
Right? I would say here's the thing that a lot of folk aren't thinking truly about when it comes to single payer Medicare for all, and that's the supply and demand curve. Right? So there's no other way to think about it other than hospitals and these amazing academic medical centers we have here that do a tremendous amount of research and, you know, coming up with like vaccines for cancer.
Right.
That costs money, right? And so we're going to, under a single payer system, we're going to have to reduce that revenue to them. But at the same time, we're increasing supply because it's free.
Right.
So, you know, I mean, we still live in a fairly predictable kind of economy of supply and demand curves, and that one just doesn't seem to work. So, yeah, we're also going to have more people potentially unemployed, right? And not just from insurance companies. As that revenue starts to decrease to the hospitals and they now go underwater, where are they going? Because hospitals are the number one employers in most counties across this country.
Yes.
So I think the ramifications for this are way beyond what anyone is publicizing in their campaign trails.
Yeah, sure. And I think it's not just in your industry where we'll see a lot more people unemployed. It's this unknown, the void we're coming into in the middle part of the 21st century. So many jobs. I believe the number is we will lose by 2035 some 32 million jobs to automation.
Yeah.
Where where are these people going to? Where are they going to work? How are they going to support their families? There has to be some kind of change. So it's not just, it's a concern throughout workforces and obviously, organized labor going forward. And so we don't know 100%. It's an unknown, but we have to be prepared. That now is the time to start talking about this. I know Tom has had conversations with myself and a lot of my colleagues at a number of meetings. As far back as 4 or 5 years ago when we were starting to, Medicare for All wasn't a topic of conversation. It was a different president. We were under the Affordable Care Act, the ACA. And so things have changed dramatically, but we were talking about the future back then. So as is a common thread on this program, it's always better to be prepared about some of these things that might be coming down the line because you do not want to be blindsided by it because it be absolutely disastrous otherwise. Let's take a break. Let's get back. When we come back, we'll talk about the union's involvement and how the unions can help the future and be involved in the future of healthcare and what we can do to make everything better and wrap this educational session up with maybe some finite answers. Guys, hang with me. Justice Matters will be right back after this.
This is Justice Matters with Patrick Cullen, president of the New York State Supreme Court Officers Association.
We're back on Justice Matters, continuing our conversation about the state of healthcare. How can we, Tom, this one really directed at you, how can we, the unions in New York, again, the building trades are separate from the public employees and private unions and things like that. How can we be a driving force in the insurance industry and partner with healthcare providers? And then also, in a second, kind of follow up to that question, how can we get involved on the legislative side of things?
Well, I'll take the second question first.
Sure.
I think I've been really thrilled and happy with the last couple of years, and the unions have gotten much more involved with healthcare in Albany, and in a very, very positive way. I think they've come to the realization that it's their dollars, and that, not that they didn't know that before, obviously. I'm just probably restating the obvious there, but I think what's happened is, because there are so many now public policy issues in Albany that affect their health funds and their members' health plans, they've gotten much more active in things that might have been viewed as tangential before, but they have direct impact on their plans.
Right.
So I think that's a really, really important thing that they've done, and we're very happy to work with them, and to work and to give them information, and to also have a dialogue, which we did last year at the last year's PEC conference.
Sure.
A lot of the controller was there last year, and a couple of state senators. So I think it was a really good dialogue we had.
Absolutely. I think it's also, you mentioned the last few years, I'll draw that line between, some of the battles unions and labor have been involved in over the last few years. Constitutional convention was a big issue for a couple of years.
The CONCON.
The CONCON, Janus versus AFSCME out of the United States Supreme Court, and some of the issues surrounding that, including just the general attacks on organized labor throughout the country. We've coalesced around those issues for the last few years and been victorious in a lot of ways, in either defeating the CONCON or by preparing our members for the ultimate takeaway from Janus. Yeah. But now I think we view this as a group, and I'm never presumed to speak on behalf of a much larger group, but being as involved as I am in some of the discussions when it comes to labor leaders in this state, this is the next big battle. So we are engaging, I think, a little bit more. And so to your point, I absolutely see it myself as this is now when you do have meetings together, this is the top of the agenda, because we have, we've been successful in a few things in the past, and that hasn't always been the case in organized labor in New York. But this is the next big battle. This is the mountain to climb.
Absolutely.
Yeah.
Absolutely. And then to address your first question, I think, I referenced it briefly before. I think each union fund has to look at their membership and look at what their particular needs are. I referenced primary care before, and I think that's one of the areas that we've been, as a company, very active in paying primary care doctors more, rewarding them for keeping their offices open longer. And I think that's something where the unions could get involved and, work together on getting more primary care doctors in New York State, paying them more, because let's face it, I mean, when you graduate medical school, especially if you come from a background like I came from, not very wealthy background, it's very hard to get to medical school. So if there's some way the unions could coalesce with the healthcare industry in getting more primary care doctors and making their load a little lighter as far as their college loans goes. I mean, that's a very good step in that direction, I think, anyway. And plus, it's helping people that are getting lifted up from, their parents might have been, unionized workers and street cleaners or from office workers,
sure.
And you're giving them an opportunity to get into the middle class, upper middle class.
Upper middle class,
right.
So
it's a pretty good thing,
Yeah, absolutely, 100% agree. I was going to talk about some programs within Empire that can drive better health for Empire members and all New Yorkers. But I do want to point out that on the how can we get involved angle, we provide through our welfare fund a number of preventative health programs. The one we really promote and have had an unbelievable success with is heart scan services, who we've had as a guest on this program. So we are trying to, help out by seeing if we can get you. We bring heart scan services to the workplace. You 15 minutes out of your day at your workplace, you're finding out 5 or 6 risk factors are being tested. Everything's done, obviously as professionally as you can imagine. So that's one way that we are trying to help out and somehow, shorten the road a little bit. What are some other programs maybe we can get involved with, or that Empire is offering that can drive better health for Empire members?
So I would say we're becoming hyper-focused in the, I think, more micro populations. So we take, for example, your population, and we begin to analyze it to see what is the disease status, what is going on with cost, what are the drivers for what's happening in there. And then I think the key is the education between our two entities, right? So we can say, here's what we're seeing, and you can say, well, here's the culture of your population,
right,
and here's how we interact with that culture. Because it's I mean, it sounds obvious, but one size does not fit all. And what we may do, obviously, with your population could be vastly different than what we do from, the hotel trades to the clergy, the Rockville Diocese, and so forth. So
Sure.
we really need to think carefully about how we interplay that. And listen, if a population is really into health and wellness, how do we encourage them to go even further?
Sure.
If that's not on their radar, how do we begin getting them comfortable with it and understanding it? So that we're spending a lot of time on that. We have obviously a lot of analytics and a lot of capabilities to go down that path. One of the things I say all the time is we can only take it so far, right? What we really need is that interoperability between the two of us for us to really have an impact on the person.
Right.
They're going to listen to their union, their fund, their employer. Honestly, it's almost like being in a squad within the military. They're going to listen to your brothers in arms, your sisters in arms, before you're going to listen to the person who's calling you up saying, "Hey, I think you need to do a few more steps per day."
Right. Yeah, and I think communication amongst obviously between, like you said, and that's what the union prides itself on, right? Is open, transparent communication, getting things out there, whether it's for stuff that we provide, things that you provide. All of it is meant to hit your ultimate goal, right? To make New Yorkers healthier. I have a question about urgent care. Everywhere you go, there, you go on one of the main roads that has every store on it. It has a Walmart, a Target, a Applebee's, or this or that, or the other thing. And there's 3 or 4 or 5 urgent cares. Is that helping us, or is that hurting us?
City MD, Go Health,
Yeah.
whatever. They're everywhere, right?
Everywhere.
So
almost as many as Dwayne Reed's and Starbucks.
Maybe more, actually.
Although
Listen.
sometimes there's 2 Starbucks in one block.
Yeah, true.
I just don't get that. I don't understand.
I'm waiting for the bank, the Starbucks, and the urgent care all to
All in
merge
one.
together.
Right.
Listen, let's face it. It's not urgent care. It's unscheduled care.
Right.
Right. It's rapidly becoming unscheduled care. This actually, I would say, is a good example of the unintended consequences of a good idea, right? And maybe even ties back to the Medicare for All. What are all the unintended consequences? So we started getting a lot of pressure as an industry to say, what are you doing about ER visits? How do you reduce ER visits? People are using them instead of going to their PCP.
Because they're so expensive. That's
Right. I mean,
they're very, very expensive.
Very
to go to ER.
expensive. I mean, listen, it could be $2,000, $3,000, $4,000 a visit, and obviously that's going to the fund or whoever the ultimate payer is. And so we actually were the ones who started encouraging the growth of urgent care, and we said it would be a step down from the ER, right? So if you think you broke your hand or your wrist, and rather than go and wait in an ER all day, you can go to the urgent care. They'll take a couple of X-rays, they'll look at you, let the swelling go down, they'll send you to the orthopedist.
Right.
Reality is they are not pulling anything from the ER; they're pulling it all from PCPs.
Gotcha.
Right, and so. Hey, you call up your PCP, and what do they say? Yeah, you have sniffles? Yeah, well, you want to come in Thursday, Friday. You're like, I'll just pop next door to the ER, to the urgent care.
Right.
And that's really what's happened.
So it's a matter of convenience. It's the
convenience.
7-Eleven of healthcare.
Yeah. Now, at the same time, I ask, do we want to do anything to interrupt the convenience? People are getting care.
Sure.
So I think there's another way we have to interact with urgent cares rather than just making it free, go there whenever you want. We have to figure out how to make it more part of the continuum of healthcare, which I don't think they are right now.
Guys, I had wanted to have you guys on for a really long time here on the program. I'm so glad you came on. We could probably do another 2 or 3 hours on a lot of this stuff because this has been really educational, and we didn't even do the deep dive yet. I want, on behalf of all of our members, I want to thank you and all the people at Empire for everything they do for our members. It's invaluable. We are going to work together one way or another to continue to provide the best services, the best care, and if you need help in the legislative end of things and whatever we can do to continue to make sure that our members are have the peace of mind that they're being looked after. I think that is really the goal from our end. That's what we want out of our healthcare provider. So I really can't thank you enough, guys. I wish you all the best of luck, and I'm sure we'll see you around. If you need anything, let us know.
It's been an honor. Thank you for having us.
Thank you for your partnership.
Thanks, guys. As always, I ask you for your feedback, good or bad. You can email me at Cullen, CULLEN, @NYSSCOA.org. You can check out our website, www.nysscoa.org. You can always find SCOA on Facebook, Twitter, Instagram. I wish you all a wonderful Sunday, and we'll talk to you real soon. This has been Justice Matters.